Welcome to our SCI Educational Series number 3. This series focuses on a critical patient safety priority, recognizing and managing orthostatic hypotension, or what we called OH in SCI care. SCI nurses face unique challenges in identifying orthostatic hypotension, especially due to atypical symptom presentations and the profound effects of autonomic dysfunction. I'm Michael J. Orellano, your SCI nurse educator. In this session, we will explore how hypotension affects rehabilitation, function, and overall recovery in SCI patients, and discuss evidence-based strategies for early detection, prevention, and emergency management. By participating in this educational series, you are helping to advance safety, clinical competency, and patient outcomes in SCI practice. Let's continue strengthening our expertise and commitment to delivering veteran-centered, high-reliability care. The learning objectives for this session are designed to ensure SCI nurses have the necessary competencies to manage orthostatic hypotension, or OH, in clinical settings. First, understanding the pathophysiology of orthostatic hypotension is essential to recognize why patients with high thoracic or cervical SCI are especially vulnerable. Second, nurses must be able to assess early signs, often subtle, and implement preventive strategies such as gradual positional changes, hydration, and compression. Third, emergency interventions must be executed promptly and effectively. These include laying the patient flat, raising the legs, administering fluids, and maintaining safety. By meeting these objectives, nurses will play a crucial role in improving outcomes, reducing incidents, and empowering patient-centered, evidence-based care. The critical role of orthostatic hypotension, or OH management in SCI. Managing orthostatic hypotension and spinal cord injury is essential to safeguarding patient outcomes. This condition, often under-recognized, contributes to a higher risk of stroke, cardiac arrest, and impaired rehabilitation if not addressed promptly. SCI nurses are at the forefront of identifying early signs of orthostatic hypotension, especially since many patients with injuries above T6 may not exhibit traditional symptoms. Instead, signs like dizziness, fatigue, or postural changes can signal dangerous drops in blood pressure. Routine awareness during care transitions, therapies, and daily activities is vital. When SCI staff remain alert and proactive, emergency situations can be averted, preserving both function and life quality for patients. This presentation will provide tools and clinical insights to elevate the quality of SCI care through precise orthostatic hypotension management. Understanding orthostatic hypotension, or OH, in SCI patients. Neurogenic hypotension is a result of sympathetic nervous system disruption in SCI, particularly with injuries at or above the T6 level. This dysfunction limits the body's ability to constrict blood vessels and maintain blood pressure during positional changes. As a result, patients experience symptoms like dizziness, vision changes, fatigue, or even syncope, often during care transitions or therapy. These episodes compromise patient safety and rehabilitation progress. Nurses must link clinical observations to underlying physiology, ensuring that care decisions are informed and protective. Understanding the unique challenges SCI patients face in regulating blood pressure provides a strong foundation for safe, functional recovery. Assessment and early detection of orthostatic hypotension, or OH. Bedside assessment remains the most effective strategy for early orthostatic hypotension detection. Nurses must be vigilant during all transitions, transfers, therapy initiation, or bowel care to monitor blood pressure trends. Patients often exhibit subtle cues such as yawning, glassy eyes, or pale skin. Incorporating orthostatic checks or using a tilt table can reveal blood pressure instability before symptoms escalate. Engaging family members and caregivers in recognizing these early signs also strengthens the safety net around patients. Consistent and methodical assessment allows nurses to intervene early and prevent adverse outcomes. Prevention strategies for orthostatic hypotension, or OH. Preventing orthostatic hypotension begins with strategic nursing habits. Gradual bed elevation prevents sudden venous pooling. Compression stockings and abdominal binders reduce blood accumulation in the lower body. Proper hydration should be encouraged, especially during hot weather or illness, as dehydration amplifies orthostatic hypotensive risk. In high-risk patients, medications such as midodrine or sodium tablets may be ordered. Nurses must understand indications, administration timing, and patient-specific responses to these treatments. These prevention methods, when implemented routinely, not only reduce orthostatic hypotension incidence but also strengthen overall care coordination and promote rehabilitation success. Emergency management of orthostatic hypotensive or OH episodes. In an orthostatic hypotensive emergency, immediate action can be life-saving. Placing the patient flat with legs elevated improves venous return and cerebral perfusion. If intravenous fluids are ordered, administer promptly while reassessing blood pressure and neurological status. Ensure safety by maintaining clear surroundings, placing call lights within reach, and staying with the patient. Thorough documentation, including time of onset, interventions performed, and patient responses, is essential for continuity of care and legal compliance. These emergencies demand calm, trained responses that reflect knowledge and preparedness, reinforcing the nurse's role as the first responder in SCI care. Why orthostatic hypotension or OH management is essential in SCI care. Effective orthostatic hypotension management is fundamental to maintaining patient engagement in rehabilitation, activities of daily living, and social integration. When blood pressure is unstable, progress halts, patients may skip therapy, suffer injuries, or regress. By maintaining stable hemodynamics, nurses preserve therapeutic opportunities and prevent setbacks. Nurses also serve as educators, explaining the role of fluids, binders, and medications in patient safety. This transforms routine tasks into meaningful patient education moments. A well-informed nurse not only protects but also empowers the patient, enhancing overall care outcomes and fostering a culture of clinical excellence. So, for our final thoughts. Orthostatic hypotension in SCI care is not occasional, it is a daily reality. This presentation emphasized the importance of early recognition, prevention, and emergency management to avoid life-threatening complications. Consistent monitoring, cross-disciplinary communication, and patient education are core nursing responsibilities. Nurses who champion safety by prioritizing blood pressure stability elevate the standard of care within their teams and facilities. Orthostatic hypotension management is a reflection of professional excellence and a commitment to protecting veterans' lives. Empowered, knowledgeable SCI nurses form the foundation of a resilient, safety-driven care culture. References. This presentation was developed using the most current, evidence-based literature on spinal cord injury-related hypotension. Each reference listed supports a key aspect of SCI nursing care, including pathophysiology, assessment, prevention strategies, and emergency management. These sources ensure the accuracy and credibility of the strategies presented today, aligning with best practices and promoting excellence in spinal cord injury rehabilitation and nursing leadership. Thank you for your valuable time and attention. I hoped that this presentation has made a meaningful impact on your professional practice. Please stay tuned for the next installment of the SCI Enhancing Patient Safety Educational Series, scheduled for next Wednesday. For any questions, please call me at phone 21485-72787 or my extension number 72787. You can also email me at michael.orellano@va.gov. Looking forward to your continued participation, wishing you a productive and rewarding day ahead. Again, thank you very much.